Welcome, Dr. Goldhammer, to Raw and Cooked Vegan.
Pleasure to be here.
And the first thing I thought I'd ask you a little bit about, how were you raised, like your family's dietary orientation, fitness? Was your family very conscious in that respect or not?
Well, my family became very conscious after I graduated from school, and they became patients and got on a good program. So we always ate lots of fruits and vegetables, but it was not a vegan program. I didn't become a strict vegan until I was 16 years old.
Aha, okay, that's still pretty early. All right. And then tell me if I'm right. Did you initially have some health issues that drew you to fasting, or?
Never had any health issues. I actually wanted to be a better basketball player than Dr. Lyle, the clinical psychologist. So we grew up together since fourth grade, and he could always beat me. And so I tried practicing, but it didn't work because he also practiced. So I decided to get healthier, and I read a book by Shelton, and I thought that made a lot of sense. So I adopted a plant-based diet, and I thought that would give me an edge, but of course it failed because he also adopted a plant-based diet, and to this day he can still kick my butt. It was very frustrating. So complete failure, but it did get me interested in this whole area.
Yeah, he's a bit taller than you too, isn't he?
No, we're the same height, but he's just a lot better. We did a free throw shooting contest recently. I hit 48 out of 50. I thought I'd have him, but he hit 99 out of 100. He hit 19 and then 80 in a row. And of course, I told him that, yeah, he hit 99 out of 100, but he missed one, which means he's a choke.
That's pretty good, man. I was never too good at basketball. But
yeah.
But tell me, this transitioning to veganism at 16, would you say it was a knowledgeable vegan, or was it kind of like you just gave up meat and you kind of ate all kinds of vegan food, or?
No, I adopted a health-promoting diet from the beginning because I was interested in health, not just in the moral, ethical, and spiritual aspects of veganism. So I adopted an exclusively plant-based diet and eliminated oil, salt, and sugar and foods that contain those, quite rapidly.
Okay. And when you did that at that time, did your family think you had gone off the deep end, or were they supportive?
Yeah, my family was very medically oriented. I had medical professionals. My uncle was a physician, and they thought I was completely crazy. And so at 17, I actually moved out so I wouldn't create as much stress. But eventually, they all did come around. So.
Good for you. Good for you. That's a strong will. Now,
I just turned 89. She said all 52 of her lifelong friends are dead, and she said the worst part is that there's nobody left to say "I told you so" to.
Yeah. It's sad, but I'm glad your mom benefited.
Yeah, no, they did adopt healthy eating habits early on. We put them through a period of fasting, and actually my parents did very well.
All right. On this note of reading Dr. Shelton and then adopting a vegan diet, would you say that his interpretation of healthy diet is fairly analogous or similar to what today you would consider to be a healthy vegan diet?
Well, he was really a pioneer, and I think that if he had the benefit of the information that's been available in the 50 years since he wrote, he would be saying the same thing we are, which is, there's some modifications from early hygienists included some dairy products and other things in the diet that today I don't think would be promoted or supported. But I think he was really way ahead of his time in advocating an exclusively plant-based diet in terms of avoiding the additives and food problems, and advocating fasting and exercise, and the basic kind of natural hygiene philosophy that focuses on the fact that health is the result of healthful living and not treatments and potions and powders and pills and things like that.
Okay, so you're 18. Did you attend undergraduate school in a medical vein, or did you go to chiropractic school? How did that work?
Well, I went to, I did my pre-med training at conventional, state universities in biological sciences. Attended Western States Chiropractic College in Portland, Oregon. After that, I went to Australia and attended the Pacific College of Osteopathic Medicine, and ultimately got my DO in Australia. Returned in 1984 with my wife, Dr. Jennifer Morano, and we opened up the TrueNorth Health Center at that time.
Okay, fantastic. Can you tell a little bit, this is kind of my ignorance, but I think other people might be interested too. A doctor of osteopathy, is perhaps a little more accepted within conventional medicine than, say, a chiropractor. Is that accurate?
I don't know what's accepted in conventional medicine. I do know that osteopathy in Australia, though, is very much analogous to chiropractic in the United States because it's a drugless profession.
Okay, gotcha. All right. Now, when you first got out of school, out of chiropractic training, was nutrition going to always be a primary focus of yours? Was adjusting a big part of what you did? Did you always knew you wanted to do a kind of fasting institution? How did that evolve?
I went to school because I was interested in healthful living, diet, exercise, and fasting. At that time, this is 30-some years ago, the medical profession had very little interest in anything that had to do with promoting health. The chiropractors had a tremendous amount of interest, so did the naturopaths. At that time, naturopathy was not well licensed, and so it made a lot of sense to pursue chiropractic college as a fundamental way of getting training in terms of functioning as a physician. And the school that I went to, Western States in Portland, had a great deal of interest and support for nutrition and even fasting. So that was good. And then I learned how to use fasting properly by studying with Alec Burton and going to Australia and doing a residency at the Arcadia Health Center.
Okay. So that's a center that specializes in fasting.
It does.
Okay. Now, you were probably familiar with natural hygienic facilities throughout the United States at the time, right? I remember, back in my 20s, I did a little trip and I interviewed some folks at some of these places. There was Dr. Esser's Ranch in Florida, the Pauling Health Manor. I think they did fasting in New York. Can you say a little bit about, one of the main things I wanted to talk to you about is why, when this knowledge has been available and so much recovery has occurred with the application of these principles, why is it so little known in the broader public?
Well, I think it is becoming much better known. With the recent publication by Walter Longo and other hardcore primary scientists in journals like the Journal of Metabolism, the use of fasting is becoming much more broadly known and accepted. There's certainly been dramatically more stuff done recently than in the past. But the practice of fasting is a challenge from a clinical standpoint because it is an inpatient type operation. So you have to have an inpatient facility with round-the-clock medical support. You have to be able to do rounds on patients and monitor patients. It's much more intensive. And there's no real money in it, and because it's not reimbursed by third-party payers. And so the clinician can generate dramatically more revenue moving people through an outpatient practice than they do by providing, intensive care on an inpatient basis. So I think that the lack of financial incentive, the lack of third-party recognition, and also there's a lot of legal challenges to doing this type of operation because there's many people that do not believe that the use of diet and lifestyle and fasting is appropriate and efficacious. So they'll challenge that from a medical legal standpoint. So there's a lot of roadblocks, not the least of which a lot of the doctors that make really good doctors, like doctors that work for the TrueNorth Health Center, don't want to be business people and be running things and having, an operation. Like the TrueNorth Health Center has, 56 patient beds. It has 48 full-time employees. It has 11 clinicians. It's a big operation. And that requires, lots of employees and lots of management and lots of things that most doctors just want to take care of their patients. And that works out well for us because that's the kind of doctors we hire that want to just do a good job of being a doctor and not have to be running around. And as a consequence, it works out really well. We can get really good doctors that want to do something worthwhile with their life and actually get people well. And so, it makes for a good combination. But individually, they don't want to necessarily go out and operate. And if you look back through the tradition of natural hygiene, they were always one operator places. So one guy operated the place, kind of ran it, managed it. And so it limited the ability to offer a multidiscipline, multi-faceted center, and certainly prevented them from engaging in clinical research and doing a lot of the things that the TrueNorth Health Center is able to do because of our size.
Very interesting. Now, I imagine because of this intense, high doctor-to-patient ratio, you get a lot of folks saying, "I've never had such medical involvement in my recovery." Does it blow them away a little bit?
Well, I think what blows them away is that they get well, and that's almost unheard of in medicine. If you have the conditions like we treat, high blood pressure or cardiovascular disease, diabetes, autoimmune diseases like lupus, rheumatoid arthritis, and ulcerative colitis, necrosis spondylitis, and asthma, eczema, if you have those conditions and you go under conventional medical care, they will guarantee you'll never get well. They will promise you that you'll be on the drugs the rest of your life. They'll also tell you that none of their patients ever actually get well, and the one thing they'll all agree on is diet and lifestyle have nothing to do with it. And so as a consequence, we take a very different approach. We believe that the goal is to recover from the condition, get off the medications, improve both the quantity and the quality of your life. But that requires doing dangerous and radical things like eating really well and exercising and going to bed on time and possibly undergoing medically supervised fasting if it's appropriate.
Yeah, I mean, it's outrageous that you have to, and I imagine you've said this stuff so many year in and year out, and it's probably it's by rote, but we just have to keep repeating it until it is accepted by the broader public. But it's beautiful to hear you say these things. I was really into natural hygiene in my 20s, and I had kind of decided I couldn't make veganism work, and so I settled for vegetarianism. But if I had just pursued it a little more, I could have probably made it work. So within the past 2 years, I've been strictly vegan as I finally worked out some of those principles. But so I wonder if you could tell people a little bit about some of the things you've learned and seen through fasting. So I imagine when you were doing your training and perhaps prior to, you did a little bit of fasting on your own just to familiarize yourself with it. And then can you describe to people some of the things that they may find a little bit hard to get their heads around in terms of what can occur during the fast, because there can be what you might call detoxifying events.
Well, generally, fasting can be an intense and miserable experience, and only if people have good results that they forgive us for that. Early phase fasting, commonly people's mouths coat up and taste like something crawled in there and died. They have low back pain, often early phase of fasting as the kidney's going through its macerations, skin rashes, discharges, nausea, vomiting, diarrhea, headache, low back pain, irritability, fatigue. It's rather entertaining, actually, watching people going through this process. But not so much for the patient, but for us. And we understand that these are processes where the body's attempting to heal itself by generating an acute process out of a chronic condition. And so these characteristic changes happen, and eventually they go away and they clear out, and then it's not quite as entertaining, and hopefully that's time to break the fast and then adopt a health-promoting diet, exclusively plant-based diet with the exclusion of all salt, oil, and sugar. The area that we get into some differences is actually in refeeding. There are some people that advocate an exclusively raw food diet, for example. They're putting people on very high concentrations of fruit. And that doesn't work for everybody. There's many people that do much better using both raw and cooked vegetable materials, so steamed vegetables and starchy vegetables. And there's certainly reasons for that. But we see a lot of the people either that have not been health conscious and they're addicted to drugs, they've been under medical treatment, they've gotten a lot of poor advice that we have to unwind all of that, or they've been doing their best to do really well, but they've crashed and burned because they're 2 years into a fruitarian diet and now their teeth, nails, and hair are falling apart. They're getting recurrent infections. They've got emotional volatility. And the eating disorder that drew them to their raw food problems to begin with, although they may have mitigated their obesity issues, they haven't actually dealt with their underlying emotional and psychological issues. So we have a lot of people that we see on both ends of the spectrum, very health conscious but not necessarily living healthily, or very unhealth conscious and not living healthily. And so we try to help both people come to what we consider a middle ground, which is an exclusively plant food diet that avoids salt, oil, and sugar. And that includes the agave and the processed sugars and the honey and the maple syrup and all the processed, packaged, heated, beaten, treated, chopped, diced, overly expensive materials that are being sold to people under the guise of being superfoods and all the pills and potions and things like that. We go back to just real basic things like eating a good whole food diet. So that means like fruits and vegetables. It means starchy vegetables. It means nuts and seeds to the capacities of the individual. Not everybody can eat every kind of food. For example, many people are grain sensitive. So even non-glutinous grains like rice or things may cause them problems. So we don't use those. We use starchy vegetables. They might use Hubbard squash or butternut squash or sweet potatoes, and they use lots of green vegetables and lots of appropriate fruit. We try to avoid a lot of the processing, all the juicing and the dehydrating and the drying, and really as much as possible relying on whole food. Our targets are, we're looking for protein levels to be in that 10-12% of calories. We're looking for fat in that 12 to 18% of calories, and the balance coming from starchy vegetable material. And so, and that works really well for a large variety of people. Now, there are some people that you can modify the diet, going to a higher percentage of calories with fruit. They may do okay. There are people that can't really tolerate, say, fruit at all because they've got problems with fructose or sugar or whatever. And so we'll eliminate that class of food and go into a vegetable-based diet. I have to say the biggest deficit I see in people trying to be healthy is they don't eat enough vegetable material.
Yeah.
Everybody likes the fruit because they're all got their sugar cravings and addictions and all that stuff. But they don't like, or they don't eat enough of the low caloric density, high nutrient vegetable material. And I think we should be more worried about what we're eating than how we're processing it. You know, we advocate the use of steamed vegetables. Other people are spending their time blending and juicerizing and all that kind of stuff. And I got news for you. From a biological viewpoint, we've been steaming food for at least 500,000 years. We've only had blenders and juicers for a relatively brief time. So from a natural viewpoint, it's a lot more natural for humans to include heat as a way of processing starchy vegetables than it is to think that juicing and dehydrating and all that kind of stuff is necessarily, you know, natural.
Love that point. Love that point. Do you ever run into complications because people resort to fasting as a last resort? In other words, they've tried all other medical modalities, and now they've got nothing left to do, so they come to you guys, and they're at this state of health that's so poor, it complicates the situation?
Well, we see a lot of really seriously ill patients, but we specialize in treating people that are going to have good results. So part of the job is to try to pick out the people that are most likely to do the best. And that includes both physically and psychologically. So it means we turn a lot of people away because, you know, for whatever reasons, our predicting variables don't suggest that they're likely to have a good result with our approach. And we'll suggest they do something else. So that helps. So we get a lot of highly motivated people. Many of them are very seriously ill, but we try to narrow our focus to the people that are likely to be able to make and sustain recovery. What we're working on right now in our research is looking at the different types of ongoing support that may be helpful at helping people sustain compliance to a health-promoting diet. Obviously, when we're here at the center, it's easier to get people to do what they're supposed to do, and they respond appropriately. When they go home, it's sometimes a challenge because they're going back to a world designed to make them fat, sick, and miserable, and give them what they want, not what they need. And so not everybody's going back to a supportive environment. And as a consequence, there's a problem with recidivism and going back to bad habits and old addictions. And so we're working now on trying to develop approaches that are going to improve our ability to provide meaningful ongoing support. And that's, you know, that's one of the areas that we're looking at in terms of our research.
Okay. One of the senses I get with your facility is this very high level of professionalism. And I think that's really excellent for fasting, because of some of the reasons you addressed earlier in terms of public awareness of fasting. I wonder if you could speak a little bit about some folks who have tried to conduct fasting but maybe didn't have the same kind of professional capacity and what you think about that.
Fasting is a safe and effective process when it's done properly. The problem is that you have to be able to select people who are good candidates for fasting. In order to select patients that are good candidates, it requires certain information. A complete medical history, a physical exam, appropriate laboratory testing. And for people to do that, they have to have a certain level of training and expertise. And so what happens is a lot of very well-meaning people go out and decide because they did a fast, they know how to supervise it. And that works well most of the time until they get into a complication and they have no idea what they're doing. And then you have really bad outcomes. And then our literature is filled with stories of people that have gotten screwed up because somebody was not well educated enough or not using appropriate protocols to be able to safely and effectively monitor and supervise that process. And so I think that's where the problem is. It's not fasting that's the problem.
Right.
We've done this for 30 years. We've had over 15,000 people complete this fasting process. We've recently completed a fasting safety study on 2,500 consecutive patients. This can be done safely and effectively, but it requires a certain level of expertise and appropriate protocols. Now, why doesn't everybody do that? Because it takes time to take a history, do an exam, monitor people twice a day, do appropriate laboratory testing. You have to have a certain level of expertise and training. And so what people say is, oh, you don't really need to do that. Those people are sold out to the medical or the scientific model, and you can just do it. The body does it itself. You don't have to worry about it. And maybe, at some time in our history that might have been true, but not today. You're looking at third-generation junk food people that have had exposure to toxic environments and drugs and all kinds of things, and it's not that simple. And probably the most important part is patient selection, picking people that are good candidates for this intervention. And so when people undertake fasting with people that are not good candidates, of course there's going to be some times where things don't work out the way they want to. The tragic thing is many of the complications you read about and hear about are completely unnecessary. They could have been avoided or they could have been managed better. Yeah. And that's, but again, it's fairly rare because this is a biological adaptation. This is a safe process. It's just that people are screwed up nowadays, so things happen.
Well, yeah, and I think another point on this is that when something like this happens in an alternative approach, well, I say alternative, I hope that it eventually becomes the primary means, but I guess still you could call it alternative. And when, despite the fact there's been much good and much curing and much positive, successful treatment done in this regard, when you have an occasional error like you're talking about, it gets highlighted to the nth degree, while at the same time in traditional medical hospitals and with traditional medical treatment, you have thousands daily passing.
Well, in fairness, though, you have millions of people being treated medically. You have a handful of people that are undergoing things like fasting. So, of course, you would expect the numbers to be much more significant. I would have to say that, if you treat enough sick people, things happen. But it's our responsibility to try to, monitor those patients effectively and provide an environment, that can minimize the likelihood of untoward reactions. And clearly, we've been able to do that. But in order for me to feel comfortable, it requires a high degree of supervision, and that's why we have medical doctors, chiropractors, naturopaths, and psychologists working in an integrated clinic. That's why we see each patient twice a day. That's why we operate a contained environment. That's why we screen patients properly. That's why we do a lot of the things that we do. The challenge has been doing that level of care at an affordable rate. And I think that's really one of our best accomplishments, is that we've been able to keep rates more affordable, dramatically less expensive than virtually any medically oriented inpatient facility anywhere that I know of. And frankly, we're competitive with even the people that provide care that don't provide the degree of medical supervision. So we've done a good job of managing how to keep the thing affordable. Part of that is that our foundation, the TrueNorth Health Foundation, is a 501c3 nonprofit foundation that does receive support to help with our research and help with our operation. We have a group of 46 really dedicated employees that do an excellent job, and they are very productive. And so we're able to provide a high degree of care at an affordable rate. We also have a residency training program where doctors come in and spend a year with us as part of their training. And so we get a lot of new, young, very enthusiastic doctors that are willing to be up at night and providing night call and do all that kind of stuff. That really does help the efficacy of the operation. So there's a lot of little pieces that go together to it that you just can't do in a single person operation, particularly if the individual that is operating it doesn't have the benefit of that type of background experience and training.
Yeah, yeah. I don't know if you remember, there was a Bernice Davison who ran a facility in Tilley, Arkansas. It was called the Oasis. And she was a natural hygienist, and she had been a professional nurse in traditional medicine, and then she opened her own facility. And I fasted there a little bit, and one of the things she said, she was getting on in years, I think she's since passed, but she said that we have enough knowledge regarding diet now that it's not as necessary to fast. And I wonder if a lot of the folks you turn away are people that you're able to guide through diet rather than recommending a fast.
Well, it turns out that, many of the people that I talk to in our initial pre-screening, the way it works here is people go onto our website at healthpromoting.com and they fill out what are called registration forms, which gets me their medical history information. Then they call in and we offer a free consultation. So they can talk to me about, what their situation is and whether or not this kind of an approach might help them. And in preparation for the possibility of them coming in, whether it be for water fasting, juice fasting, or a healthy eating program, we give them advice. And sometimes that advice is sufficient that they resolve the problem before they have to ever come in. and then sometimes in very significant problems that people have gone through all kinds of evaluations for, they can, just by cleaning up the diet a little bit better, resolve their problems. That happens a lot with fruitarians, where they're calling up and thinking they're doing everything right, and they're having all these characteristic symptoms. And just by getting them to modify their diet and stop with so much sugar and get on a lot more vegetable and trust, that's enough to kind of resolve the chronic yeast infections, get their teeth, nail, and hairs to start functioning better, overcome the emotional volatility, deal with the recurrent infections, increase the energy, get rid of all the things that seem to happen. And the deceptive thing is it doesn't happen day one. They might do great for a year or two as they're losing weight until eventually they get depleted, and then it's an issue. Called neurological problems that literally nobody's ever checked their B12 level. And, you check and it turns out they've got a characteristic deficiency syndrome that comes from being on a diet that's not adequate in B12, and you can correct that, and you can see changes sometimes very rapidly, just with very simple interventions. So yes, it's true. Many times we can actually help people just by manipulating their diet. Other people are so sick that you really can't go to the vigors of fasting until you get them off their medications, and that might take a time. That's why some people are here for a week, some people are here a month, some people are here as long as a year or longer. Just on getting them off of all the medical management and all the drugs and the antidepressants and all the things that create so much damage in people's bodies, unwinding that can be really tricky. The condition itself often isn't the problem, it's the treatment that they've been receiving for long periods of time.
Yeah, I mean, it's amazing. It's kind of common sense, but and I'm you're preaching to the choir, but it makes so much sense. So many things I want to ask you. I think something that's kind of unknown in the broader public is that frequently tumors over the course of a fast will be broken down. I think Dr. Shelton used to use the term autolysis. I don't know if you still use that, but can you explain that process?
Well, autolysis is in fact, it's being recognized again in some of the modern fasting research as this process that's facilitated where the body selectively goes in and mobilizes tissues, and as Dr. Shelton liked to talk about, an inverse relationship to the value of the body, and it'll wind up. For example, if you have a tumor, you might lose 10% of your body weight, but you might see the entire tumor resolve. It doesn't just necessarily shrink by 10%. So the body apparently has some ability to decide what it wants to mobilize and not mobilize. In fasting, for example, nervous tissue is preserved. In animals, even that are starved to death, generally the nervous systems are preserved, whereas other labile tissues are mobilized. So the body kind of has some internal wisdom that's quite dramatic. And in many cases, you can see tremendous changes. In fact, we have a paper right now that's in review at the British Medical Journal. We're seeing if they're going to publish it, but it was on a patient we treated with lymphoma cancer. And she had lesions upper and lower extremity that were quite large, and was monitored for a couple of years, had her biopsies and CT scans, was discouraged from fasting by her conventional medical people, but decided to do it anyway. We fasted 21 days, resolved any palpable sign of the tumors, went back, had her follow-up scans, confirmed the improvement, and we were able to write a case report up on that just recently, because it was really nice at the pre, the post, all in short duration and proximity to 3 weeks of fasting. Now, that's one type of cancer that tends to respond very well to fasting. There are other types of cancer that may not be as responsive. So, you have to remember when we talk about cancer, there's lots of different conditions and lots of different patients. And so you can't really generalize just by using a broad term like cancer and have any realistic expectation of what you're going to be seeing.
Okay. But is it fair to say you think that the cancer in general has such a strong hold on the public consciousness in terms of that it's going to need very strong medical, perhaps chemotherapy kind of treatment, and that some of these cases that would otherwise be treated in a very strong way by traditional medicine that are life and death situations could actually be resolved with fasting.
Well, if people are interested, they can go onto our website. We have an article that talks about the use of fasting in cancer. Again, done at USC. They talk about when you introduce fasting in conjunction with conventional chemotherapy and radiation, fasting protects healthy cells and makes cancer cells more vulnerable to conventional therapy. And there's a dramatic increase in effectiveness of conventional therapy when fasting is utilized because of these metabolic changes and protective things that are induced in fasting. So that's become pretty exciting in the medical field because they're recognizing fasting can allow them to do their conventional therapies much more effectively. Well, it's also true that some of the genomics of cancer and things associated with cancer turn off with fasting itself. But it is true that many times fasting is not sufficient in and of itself to resolve certain types of well-established cancers. In this particular patient, fasting alone was sufficient to demonstrate a significant result. There'll be many other people, though, where fasting on itself, they may not even be able to undergo fasting, or even if they could undergo fasting, wouldn't be sufficient to resolve or manage the condition. So again, you have to, the danger comes in when people they'll see a case report like we've reported and decide, well, that's true for all cancer, and everybody's going to come good. And it just isn't that simple. On the other hand, it's not good when the medical side says that what we do is criminal quackery because they're ignorant. And part of that is because they haven't published enough papers so that they can see the logic, and so it's perfectly reasonable that they think that we're crazy quacks because it sounds too good to be true. And it sounds just as crazy as all this other stuff out there that we might all agree is nonsense. So we have to take responsibility to publish in peer-reviewed journals evidence that shows that what we're doing is actually safe and effective. And we are actively in the process of doing that. I'm very happy to say that the TrueNorth Health Foundation has made huge strides. We are currently interviewing for an active principal investigator. We're forming coalitions with other university-based research groups, and we will be turning out, including later this year and certainly next year, significant papers that will blow people's minds, because it turns out that fasting is a very effective way of dealing with a certain type of conditions that are caused or made worse by dietary excess.
That's fantastic. It's fantastic. I wonder if you could break this open a little bit for us, because I've gotten the impression, hearing Dr. McDougall, that there are tremendous funds available for vested interests to conduct medical studies that support desired outcomes.
It turns out we haven't been offered any support from the American Dairy Council or any of the pharmaceutical companies. They're not breaking our door down trying to fund our. But there are things that are happening that have been funding our research. For example, people that use Amazon can select TrueNorth Health Foundation, which is TrueNorth, one word, as their charity. And then Amazon donates 0.5% of everything that's ever spent to the TrueNorth Health Foundation. So that's been great. And now we get checks that help fund our research from our supporters that are out there that select TrueNorth Health as their charity. We have people that have provided legacy funding through bequests, through endowments, through charitable trusts, and that's all just starting to happen, and that's going to be very exciting too. So people can be helpful instead of supporting maybe the traditional cancer societies or whatever they've chosen to promote the innovative work that we're doing at the TrueNorth Health Foundation, and we certainly appreciate that.
That's beautiful. Can you give us kind of a general idea of how much it costs to conduct a study? Now, of course, I know there'd be a huge variability, but I think people, and myself included, we don't really know what the costs are.
Right. Well, for example, to fund our study, medically supervised water-only fasting in the treatment of hypertension, which involved 174 consecutive patients with high blood pressure, we were able to demonstrate the largest effects that have ever been shown in treating high blood pressure in humans. 174 out of 174 patients were able to lower their blood pressure enough to eliminate medications with an average effect size of over 60 points in stage 3 hypertension. So that paper, if it were funded through a traditional university-based system, would require about a $5 million grant. Now,
$5 million?
$5 million would be the cost to fund it if you were try to reproduce that study, through traditional thing. And that would be conservative, probably more than that. However, in our case, we were able to fund it, in part, patients paid for their care. That was $1.5 million. So the cost, even at our rates, it still adds up when you add up that many people.
In essence, your facility became a laboratory.
It is actually a human subject laboratory. It's what its design was from the very beginning. But my interest from the very beginning was always to be able to conduct prospective human trials and to demonstrate and determine whether or not this works, how well it works, and how to make it work better. And that's exactly where we're at now. We subsidize it in the sense that we have residents that do literally thousands of hours of work as part of their training. So it's, we provide room and board. We don't have the professional costs of supporting that. There are people that have been true heroes, like T. Colin Campbell from Cornell University, the co-author of our studies, who stepped up and made it possible for us to get our data analysis and help us just tremendously in both the writing, the editing, and design, and actually ultimately getting it published. And so, these people have been just tremendously helpful. Interestingly enough, we put out a call recently. We have a position now because we have gotten some funding for a researcher. And we got a number of researchers that contacted us and said they wanted to help support our work, but they had to do it anonymously because they work for the pharmaceutical industry. And so we have some people now that have been very helpful in terms of giving us advice and guidance that are very well-established researchers, but in kind of the opposite end of the spectrum. So
isn't that amazing? I mean, that is just speaks to the. I mean, it's great. I'm glad they're helping you, but it's a shame that they have to keep themselves anonymous. I mean, it's crazy.
Well, if you publish a study that says the most effective treatment for the leading cause of death and disability, which is high blood pressure, is to do fasting, that's not exactly going to endear you to the people that are making their living selling people pills and potions. Okay. Also, think about it on another side. Let's say you're an oncology group that's treating lymphoma, and some quack in California decides that diet is going to make a difference or something. Does that mean you now have to offer your patients an alternative and go through all the distractions of having to do something that most of them aren't going to be interested in doing, and it's just annoying, and they don't want to have, they got busy or better things to do than worry about that kind of stuff. So it's not like there's people knocking themselves down to try to help us, demonstrate that what we think is true is true. On the other hand, there are people now get published in mainstream journals that are, making roads, and we'll see. The fact that we can get a paper even accepted for review is a step forward. I'm not sure that would have happened, in years past. So, hopefully we'll be able to break into the mainstream of the medical literature, and that'll allow conventional physicians to realize, oh, there are alternatives, and they are effective, and okay, now we can kind of explore that and, move forward.
And on this note, I'm sometimes guilty of this, having read natural hygienic literature for many, many years and known that this was available, I've become somewhat skeptical and highly critical of conventional medicine. But most of these folks are people just trying to do their jobs and working with the knowledge they have. They think they're helping people, right? I mean, would you?
You're very generous. I think that most people are trying to make a living, and so it's their job. And as a consequence, they're not going to rock the boat too much because that's going to cost them their funding and their status, and that's a problem. And I think a lot of physicians completely understand. Do you think most cardiologists don't know that, diet and smoking and these things, exercise, are like the issue at prevention and reversing this disease? They didn't read Ornish's article in Lancet that shows you can reverse this condition. Why aren't they spending more time talking to patients about this issue? Because they've given up. They don't think people are willing to quit smoking or eat properly. And you know what? Mostly they're right. We're in a situation where we're seeing highly self-selected, highly motivated people that are willing to do something like undergo fasting and make diet changes. So it's easy for us to say, why don't they just tell people the truth? It's quite frustrating if 25 out of 26 people you talk to, don't even want to hear about it. They just want the pill, the potion, the stent, the bypass.
Yeah.
And so, I completely understand it. Plus, they're in a position where they have to see 26 patient contacts a day. This is a very time-consuming process. It's a challenge. So I think it's mostly about making a living. You notice a lot of the people that kind of come around are kind of end-of-career people. And so they're no longer as worried about dominance.
They're not going to get fired or
something, they want to get salvation there and try to get into heaven instead of go to hell. And so they're going to try to do the right thing.
Well, I guess it's better than nothing. I mean, it's better late than never, I guess.
Yeah. And that's fine, and we welcome them all because, we've got a big task out here. We have a fabulous data set. In fact, one of the things we're trying to do right now is hire another physician. So we have an opening at the TrueNorth Health Center for a full-time medical position for a doctor that wants to do something worthwhile with their life that's got good skills. And, they should contact us because, we're growing and we need help to do what we're doing. And so, if you know somebody, have them give us a call.
I do know someone, and I am going to recommend that. You're reminding me of something else we discussed the other day, and I hoped you'd address it a little bit here, which is neurological diseases. So you had referred me to the fact that you guys have a general protocol, at least in terms of Parkinson's, and
Yeah.
I know Dr. McDougall talks about Dr. Swank, who worked with MS, and it seems to me that there are, I'm going to oversimplify it, but it seems like there are factors within all these neurological illnesses that overlap to some degree. Perhaps there are some that are completely unique, but generally speaking, what's been your experience in terms of treating these kind of illnesses with diet and fasting?
Well, Dr. Swank has done excellent work, and Dr. McDougall has taken over for Dr. Swank in his work and research, showing that MS, which is more akin to an autoimmune disease, where there's a demyelinating process, still debating about exactly why that occurs. But if you adopt a health promoting diet, the rate of progression of that condition is clearly affected. He demonstrated in his lifelong work, and Dr. McDougall is reinforcing that diet matters when it comes to managing MS. We utilize fasting with MS. It's done pretty conservatively. MS patients are not good candidates often for very long fasts because their recovery is slower because of the nature of the condition. So we use short fasting, and then we focus on the diet and the exercise. And I think the results are gratifying. I think you can do very well with patients that are motivated. Parkinson's is actually a completely different kind of condition. Again, there's a lot that's not known, but we do know in Parkinson's that the medical management is really bad. And what happens is part of the medical management is the use of L-DOPA, which works well at controlling tremors. It doesn't cure the disease, but it helps you manage it. The problem is if you give unopposed L-DOPA, people get severe nausea. You just can't take it. And so they give you another drug called cardopa to stop nausea, and it works really well. But it does it by binding your vitamin B6.
Say that again slowly.
It does it by binding all vitamin B6 in the system.
Okay.
And so what happens is eventually you get depletion issues, and the 200 metabolic pathways associated with that become dysfunctional, and then death rates go up and disability and complications ensue. So what happens is now you're seeing that in the data on Parkinson's disease. The outcomes are poor, and people are even starting to associate all of these symptoms as a natural part of Parkinson's disease because that's how the management is. Marty Hines has done some research suggesting that there's a better way of managing Parkinson's disease, still using L-DOPA as an over-the-counter nutritional supplement, but using amino acids and nutrient supplements as an alternative, as a nutritional medicine management approach. And one of our doctors, Dr. Sultan, is trained with Dr. Hines, and he's able to offer that as an option when we're helping people with Parkinson's disease manage their condition. So we still do all the things we do with diet and exercise. We have rehabilitation and training, all the normal stuff. But in addition, we have this nutritional medicine option, which for Parkinson's disease seems to have particular utility. And so people are able to stabilize off the medication, and that avoids the damage that occurs from the long-term use of medication. And Dr. Hines' research suggests that it's a dramatically more effective way of dealing with that condition. So that's something we've been pursuing because fasting is not enough alone to resolve or manage that condition. Diet is not enough alone to manage or resolve that condition. So when we run into a situation like that, then we look for other options that are effective. And that happens. What we did this because I got frustrated because we couldn't get the kind of results I wanted to see using traditional standard natural hygienic approaches in managing that particular condition. And we learned why, and we're able to adopt strategies. One thing that's really cool here is we have people that are trained in conventional medicine. Dr. Sultana went to Case Western, did all the traditional residency, board-certified family physician. So they understand medicine. They also understand natural hygiene and healthful living, and as a consequence, they can blend those two. And unlike myself, who has this knee-jerk anti-drug, anti-medicine reaction to every behavioral, he's more
a man after my own heart.
he's able to look at both sides and understand the nuances, whereas I have this emotional, I hate all that stuff. And so it worked out great because he can be much more open-minded. And so we work, it's good to have a team where different people's skills and subsets can all blend together.
I like that you're saying that. And along these lines, before I leave the neurological diseases, there seems to be a variety of diseases that results in tremors that get named differently. So they may have Parkinson's-like symptoms or MS-like symptoms, and then they get different names. And I don't know how many of these there are. Are these all completely isolated, unique diseases, or do you think this comes into a whole other area I want to hear you comment on, which is the modern medicine specifies to a huge degree, and that tendency to specify and to specialize, it's the opposite of the nutritional approach, which is you've got a whole system which needs all factors to be operating in harmony for the organism to function. What's your take?
You do need to be able to incorporate a holistic approach. There's huge advantages to accurate diagnosis and differential diagnosis because it can help you more understand what the underlying mechanisms might be. However, and nutrition has suffered the same consequence where people start looking at isolated nutrients and individual foods rather than the whole picture, which is why one of the most outstanding books out there is written by the author of the China study, Dr. T. Colin Campbell, in his new book, Whole, where he really presents a different way of looking at nutrition and trying to incorporate the big picture. And you have to do the same thing with holistic medicine. You have to be able to look at the whole picture, which is health is the result of healthful living. And so we have to focus on healthful living. But sometimes healthful living isn't enough to deal with the medical emergency in front of you or the complicated medical management issue. And so you have to decide, is the benefit of interventive medicine better than the cost and the price that you're paying? Sometimes, for example, using a steroid to treat an acute asthma attack might allow the person to live long enough so you can deal with why are they getting the asthma attack to begin with. On the other hand, long-term chronic steroid use, although at first it looks like a dream because you get relief of your symptoms, becomes a nightmare. Because when you shut down the immune system, of course, it turns out you need your immune system. And so it's not a really good strategy in dealing with autoimmune disease, for example, to do long-term steroid use. Better to get rid of the gut leakage and the problems and deal with the diet and the fasting and all that. But that doesn't mean there's not a role for medicine in the acute situation. Some aspects of medicine are brilliant. Like if you have a cataract, you're not going to reverse, in my experience, that cataract with fasting. Once the lens is damaged and changed, and if you don't have vision, you can fast all you want, but you're still not going to have vision. But in 10 minutes, a skilled surgeon can replace that lens with an insert that will last you the rest of your lifetime. It's fabulous, just a huge improved quality of life. Now people can see, or in cases where there's been injury and they've got a degenerative hip replacement might allow people to walk, and now they don't develop pathology better. These are unbelievable, fabulous miracles of modern medicine. It's only in dealing with sick people that they're not so good. So we have to be careful to recognize the mechanical aspects of medicine are quite brilliant. We don't want to discount those. The acute emergent management of acute illness can be life-saving. And walk into any emergency room and just hang out and watch. And you'll see people coming in with horrific problems that skilled physicians can preserve life and limb.
Right.
But dealing with chronic illnesses that are caused by dietary excess is not the strong suit of medicine. And because that means you have to do things like change the diet, exercise, get enough rest, and consider fasting. And so for those conditions, which is like, 80 or 85% of what's actually killing people, maybe it's not so good.
Say that again, because I think I've heard Dr. McDougall say this, and I want to get my head around it, and I want the public to get their head around it. 80 to 85% of all illness can be treated through healthy lifestyle.
What I'm saying is that 80 to 85% of illness, maybe less, maybe more, is caused by not controlling what you put in your mouth, i.e. recreational drugs, prescription medications, diet, getting too little or too much exercise, or not getting enough sleep. So if you look at the conditions, what are people dying from? Obesity, cardiovascular disease, diabetes, a whole host of autoimmune diseases. These conditions are all largely preventable and treatable by controlling diet and lifestyle variables. That's what the bulk of those conditions are. Now, there are conditions that are not related to this. They tend to be more exotic. For example, most cancers, breast, prostate, colon, and lung cancers. Now, there are some weird exotic cancers, some of which, by the way, even chemotherapy and radiation seem to be associated with improved outcomes. So it's not like all cancers. It's just the problem is where the treatment tends to work the best are some of these more weird exotic ones, not the ones that are caused by not controlling what people eat and live and how they go.
Right.
So that's where it gets confusing. People try to make everything black and white, nice and simple, and it's not. It's fairly complicated and it's difficult. And there's also some of the information we're getting is not completely unbiased, because there's huge financial interest in there trying to pitch you on whatever they're selling, because people are trying to make a living. And so if you recognize there's a lot of these different forces at play here, it's not all conspiracy. Some of it's just plain old ignorance, and some of it's, willful neglect. But it's not all a conspiracy. But that doesn't mean there's not concerted efforts by very powerful forces to undermine alternative voices.
Yeah. You could say money has a strong ability to make people look in a particular direction.
I would agree with that.
All right, I got an idea. I want you to tell me if you think there's any merit to it. What if we got a major well-known hospital to agree to do all cafeteria food and all food for all patients for a set period of time, say 6 months to a year, low-fat, vegan, and then use that whole experience as a study to compare to other hospital performance?
Yeah, I think it'd be a very poor study because, first of all, people's average stay in the hospital is very brief.
Okay.
And the 3.6 days or the 5.4 days of dietary change is going to be limited. Plus, people tend to eat a relatively limited amount in the because of the complications of medications and everything. So I don't think you could do a meaningful study in 3.5 or 5.6 days.
Okay.
And in fact, what they would do is say, "Oh, well, we did it. It didn't work, so we don't have to worry about it." Also, I don't know that you could do it, because if you go to any hospital and look for grossly overweight people in white coats, they're called physicians. I'm not sure what they would eat if you changed the hospital food. Because if you go to the cafeteria, the patient food is probably not any worse than what they're serving in the cafeteria. So, I'm not sure that you want to start at the hospital level to try to get change. I think we have to start at the ground root level, and then ultimately they'll change because people will demand it. Why are hospitals starting to slowly make some changes? Because people are demanding it. They want your money. They want you to, come in and have your bypass there, and if that means they have to serve you a veggie burger afterwards, well, fine. They'll do it.
All right. Tell me if you have to go. I know you're busy. I wanted to ask you a question about the evolution of natural hygiene. As you said it when we talked earlier, most of the public doesn't really know what natural hygiene is, what it means. And it seems like, prior to Dr. McDougall and yourself, if you go back 100 years or even more, and there's some isolated cases of doctors who came across these principles and gradually started to cultivate them. Maybe you could mention a few of them, but just talk about how it gradually evolved and where it's at today, and is there a future for it?
Hygiene is the science of health, and it's been co-opted. Nowadays, when we think about hygiene, we think about cleanliness, but cleanliness was just one of the components. In the early days, the early hygienists were some of the first people to advocate bathing. At that time, the medical profession violently opposed it. So we can go through. At that time they were bleeding people, to get rid of the evil spirits, and now they're putting blood in. But the early hygienists were basically doctors that recognized that the pill, potion, powder treating stuff wasn't working very well, that filling people with heavy metals and doing all kinds of toxic things probably wasn't a good idea. And Dr. Shelton actually was somebody that kind of brought all that early literature together in his writings. And then since then, Dr. Alec Burton in Australia, Dr. Kiki Sidwa, Dr. Gerald Benish, who actually got me involved in all this when I was a kid, kind of took over the reins and, continued to promote fasting and a diet. They founded the American Natural Hygiene Society, which is now the National Health Association. And, now we have a new group of doctors. Most of those gentlemen have passed away. Dr. Burton is still practicing, I'm happy to say, in Australia, and he trained me. And the TrueNorth Health Center now has done something I think really important. Is we have an active residency training program. We have 30 doctors a year that come through and spend either 1 month, 3 months, or 1 year learning how to use these principles. And so we are training more and more doctors that hopefully will eventually be able to open up facilities, and we'll be able to see, kind of a resurgence of the option to do professionally supervised fasting.
Do most of these doctors come from a particular area of training, or are they all across the board?
Yeah, they come from medicine, osteopathy, chiropractic, naturopathy, and we've even had one nurse practitioner recently that we've trained.
All
And
right.
so they're from all different schools all around the world. We have physicians coming in that have been in practice for many years, as well as the students that are coming through as part of their training. So a lot of doctors, decided they actually wanted to get some people well. And so they've decided, and they'll come and spend time with us and learn how to use these principles. Because of and everybody wants to incorporate these diet and lifestyle principles. I think that's become, much more broadly practiced. The fasting part, because of the inpatient nature of it, presents a few complications and some challenges, as we talked about before. So we haven't yet seen a lot of inpatient facilities opening, but we will as the demand increases, as our research is published, and people realize, gee, you can actually get well. That's the novel thing. And many doctors that train with us have been in practice for many years, and they'll say, oh my gosh, this is the first time I've ever seen people get well. It's just a novel kind of thing. Well, I mean, think about it. If you're in medicine, your high blood pressure, it's never getting well. You tell them, you're not going to get well. You'll be on drugs forever. I promise. You'll never get well.
I mean, this is why folks like yourself, my hat's off to you for doing this for 30 years up this hill. I mean, how do you maintain your sanity when you?
I have lots of fun. I actually get to see people getting well. Unlike everybody else, we have 1,000 people a year come through this clinic, and a significant percentage of them actually get well. And
I
so
know
that's very reinforcing.
That's right, and that's totally true. I just imagine knowing what you know and knowing how much needless suffering there is.
No, you're confusing me with the other doctors on my staff here. The other doctors, Dr. Clapper, Dr. Sultana, Dr. Lau, these are loving, caring people that actually really care about what other people think and feel, and and I'm not being critical of them. They can't help it. It's their personality. But me, no, that's not my problem. I'm not so much worried about the world thinks or what other people think or what I'm interested in doing is I believe that this is right and I want to prove it. And if it pisses a bunch of people off in the process, well, so be it.
Oh no, I'm supportive of you on that, and let them be pissed off. I'm talking about these people who are dying in hospitals unnecessarily.
I leave that worrying to Dr. Sultana, Dr. Clapper, and Dr. Lau. They worry about the world. I don't worry about them. I only worry about the people in front of me. And the people in front of me are pre-screened, selected people that are motivated and want to get well. And so it's so much more fun working with people that will basically do what they need to do to get well. It doesn't mean everybody gets well, but we're able to hit a pretty high percentage because we, pick good candidates, and then you have people doing all the work. We just take credit for it. They do the work. We take the credit. It's a great job.
Isn't there an old saying, if you're going to go to a doctor, you may as well do what the doctor tells you to do, right?
Well, if what the doctor's telling you to do is helpful, that's a good idea.
Right. It's unfortunate that's often not the case. Yeah, but
the patient I mentioned earlier done what the doctor wanted to do, they would still be sick. So the fact is, it was because they were willing to decide on their own, fully informed, that they wanted to do this alternative approach, and fortunately were able to get a good outcome. To everybody's satisfaction. That's a good reward. So you have to have pretty stubborn people sometimes.
That's right. I want to ask you one last question. I'll let you go. Do you believe, there's been this ongoing kind of argument between these paleo diet enthusiasts and vegans, and I wonder if you're convinced that as data from reliable studies comes forth, this will be absolutely laid to rest without question.
I think the data is already there. I don't know that we need, more data will come out. These, from the dead Dr. Atkins diet on down, this idea of telling people what they want to hear is not going to change. So they're going to continue to try to manipulate data to try to support that this chunk of skunk is better than that chunk of skunk, or this, change the color of your meat from red to white. It's better than. But really, it's like saying, would you rather burn to death or drown? I mean, either way.
Dr. Goldhammer, thank you for your time. Real pleasure.
It's my pleasure. And if any readers or any of your viewers would like to learn more, they can go to our website at healthpromoting.com. And if they're interested, they can fill out the registration forms and call in for a free consultation.
All right. And I've got a proposal for you. I interview vegans for my channel, my YouTube channel. And you've got, thousands of folks who've gone through your system and have had these results. If any of those people you think would ever be interested in doing an in-depth interview, I would very much like to interview them and promote your facility and So I'm just so excited about what you're doing, and thank you so much.
Greg, it's a pleasure.